Hi everyone, I'm Dr. Rebecca Harvey with Total Wellness Consultants. And today I'm making a video to talk a bit about trauma. But really what I want to speak more specifically to is why someone might consider coming to therapy for something like anxiety or depression, relationship issues, not sleeping or having an easy startle response, feeling that they are using substances or other addictive behaviors too often. Sometimes when this is the case, what's really going on is it's not quite as simple as just being about depression, anxiety, or addiction, but really it's about earlier trauma. And when I say that, I don't mean PTSD. Although it could be PTSD, there's also such a thing as something that's referred to loosely as small t trauma, meaning that it's not so dramatic or grave as witnessing someone die or having a near-death experience yourself, but perhaps just the smaller traumas that happen in life that shape the way we perceive the world. Now, a lot of times the origin for early trauma happens in childhood, and I'm referring here to relationship trauma or attachment trauma. So this can be something that's really as simple and sad as a parent who's too preoccupied with their own struggles to be present for their child in the way their child needs. So take a parent maybe who's struggling with issues of their own depression or anxiety or their own childhood trauma, addiction, or just working a lot and not available to meet their child's needs and allow that child to feel understood and seen. And if you fit into this category, what happens for you is that you then begin to create ideas or beliefs about who you are in the world, how the world works, and thus how you should engage in the world. Now this becomes a perceptual overlay, and this perceptual overlay then gets placed on everything we experience and impacts the way we perceive things going forward. Now, you've probably come across this if you've made it through the world to a certain age to see that everybody interprets situations differently. So you could have a situation where 10 different people see the same situation in 10 distinctly different ways. And a lot of people discount traumatic experiences from their early life because they don't see them as grave or significant, or maybe they miss the ways that these experiences impacted and shaped them. The reality is we're all made up of a combination of those experiences we go through in life. And unfortunately, our brain stores negative experiences to positive experiences in a dramatic ratio. A lot of studies say 5-1, although some are now saying 9-1, which means we're at a massive disadvantage because it's more important evolutionarily for us to keep ourselves safe and learn to adapt than it is for us to store pleasant memories. So a lot of times, especially in the case of trauma, we then develop beliefs about the world that the world isn't safe or we're not safe in it. And this just isn't the truth. This kind of belief leaves us feeling like a victim or like life is happening to us. And we lose our sense of empowerment, our sense of volition, or our ability to affect change in our world, which is incredibly important for self-esteem. It's often during these difficult experiences that we may check out and turn to things like addictive behaviors that are inherently soothing, like drugs, alcohol, food, sex, or working a ton. When people find themselves engaging in this way, they often show up in my office reporting a feeling of being stuck, a feeling that life isn't going the way they want, that this hasn't turned out the way they want it to, and this leads to depression. So sitting with an experienced therapist who can help you look at the beliefs you've created and look at the perceptual overlay that you're using to go forward in the world to create an experience that isn't panning out to be everything you want can be incredibly helpful. It's really different than just talking over your woes and struggles with a friend. Discussing things with a therapist allows certain interventions to be implemented that actually help to rewire your brain. Now, I speak a lot about these different interventions in other videos on my website, and you might check those out. So whether you decide to do something like develop a mindfulness practice or use something more structured like EMDR to address trauma or address things through talk therapy, a therapist can be extremely beneficial. What happens when you work with a therapist is that as you recall the memories and experiences of the past that have been ineffective for you, the interventions used and the presence of a compassionate and caring other in a safe environment allow you to store that memory reconsolidate that memory into your brain in a different way. What happens is that memory, that experience is forever changed, because now you have this experience that was painful and it becomes linked up with the experience of being cared for and supported. Now, this happens because of the big rule in neuroscience, which is neurons that fire together wire together. And I love this idea because it really speaks to the amount of hope we can have in healing. And that when we get the toxicity out of the way and we move toward positivity, our body and our brain move toward a miracle, toward health and healing. I just love that. And when we get all of this toxicity out of the way, we also reduce the somatic manifestation of a lot of things that emotions manifest into. And when I say that, what I mean are GI issues and other diseases like unexplained physical pain and insomnia, migraines, and other stress-related issues. My goal as your therapist is to create a warm, safe, and caring environment where you can explore the struggles you're dealing with now, the origins of the issues from the past, and find effective ways to move forward and toward the life that you want. I do this by helping you find balance in your nervous system and balance across mind, body, and spirit so that you can move toward total wellness. If you have any questions, please check out the other links on my YouTube or on my website that speak a little bit more about EMDR and other therapies and interventions I offer. Thanks for taking the time to listen, and I hope to see you soon. I'm Dr. Rebecca Harvey with Total Wellness Consultants.